or is there an argument for it to be done country by country?
Thank you. So every context is different. What is the most important is that it is driven by public health data. So it is evidence informed. This is number one. So this means that national and even subnational, there can be a different timing. At the same time, what is as important is to look across the borders, particularly if borders are going to be opened and traffic is going to be increased, that is also an international collaboration. It does not mean that everyone has to do the same thing, but the same set of principles which are embedded in our framework of transition, and we have 6 very clear criteria, is something indeed that we strongly recommend the countries to adhere at.
Thanks very much. Okay, we'll go over to Ryan Hooper, PA. Ryan?
Hello, yes, I want to pick up on Dr. Kluge's mention about the legacy of the coronavirus. Obviously, a lot of people missing social interactions will possibly be enjoying alcohol in their own homes. Regional Director, is your advice then, or your message for people to quit alcohol or limit their alcohol consumption while lockdown measures are in place?
Yes, this is definitely one of the recommendations. So that definitely to limit. Of course, everyone has to look at the own situation. The same goes, by the way, that we say the COVID-19 response is a additional moment to grasp, to quit smoking, but this has to be looked in a broader atmosphere, right, of behavior, how the persons are feeling. But to put it short, alcohol is a very bad advisor. Thank you.
Well said. So we go over to Tom Magner. Tom from Kerr's World Radio. Welcome back, Tom.
Thank you very much indeed. Can you hear me okay?
We can. Please go ahead, Tom.
Excellent. Thank you. Thank you. I'd like to bring the discussion back to your main theme of the day, and interpersonal violence, which is, of course, a critical human issue. And you've given a very clear message today. I just want to ask you about the practicalities, because if someone's in that situation, they're going to have difficulty getting the privacy in these lockdown conditions to be able to make that critical call for help, possibly can't even go online. What's your best advice to someone in that situation?
Thanks very much, Tom. Right, I'm going to go over to Isabel or Jonathan. Jonathan, should we start with you? Jonathan, could you respond to Tom's question, please? Thank you.
Yeah, thank you very. Excuse me. Thank you very much for the question. It is certainly a challenging situation, because we do know from research and experience that that attempts by women and children, for example, to seek assistance, especially when they are discovered, can actually lead to an increase in the frequency and severity of the violence that they experience. So having those opportunities to do so in safety and security is crucially important. This is where one of the initiatives and adaptations of approaches that we're seeing with calls for services and calls for support moving into different technological platforms. And the regional director mentioned the app services that are being used in some countries, where it's not related to a call, or you can utilize websites or utilize SMS services, for example, to seek that assistance. Many calls for assistance are also going through websites, and one of the features that is very prominent on some of these websites for providing services is a rapid exit button, which gives people who are seeking assistance a very rapid departure from a site if they are discovered by an intimate partner and potential abuser. Thank you.
Isabel, would you like to add to that? Anything to add?
Just that, reiterate what Jonathan said, and because of this extremely difficult situation, to highlight the role of the health and social services, not to leave these women and children on their own, and recognize that this increase of violence, it's a known risk. So a plea for health services and social services to keep this basic outreach event for families that there is a previous situation of violence, to keep on monitoring what it is the situation and outreach to and reach out to these women and children, keeping the basic services alive. Thank you.
Tom, you make a very good point there, that when you talked about the children, because children are particularly vulnerable and may not reach out through those digital platforms. That's why I mentioned the whole of society responsibility. It is everyone can do something to reach out. When the neighbors, the other, often the children will go to someone of the same age, right, who is hopefully in a more protected environment and can provide some signals. Because either sometimes the children are culpabilized, that they think it's sometimes their own mistake, or very difficult, or afraid for some revenge. So it's a very, we acknowledge, a very delicate, a very humanistic situation, and there is where really the society has to come in as a whole and then call in the help of other services. Thank you.
Thank you. Thanks very much. So we'll go over to Denise Rowland from the Wall Street Journal. Denise?
Hi, can you hear me?
We can. Please go ahead, Denise.
Hello. So my question relates to serology testing. A question I've been getting from lots of readers since writing about the Roche test, which I think is one of the most sensitive and specific on the market now, is effectively, should I get a test? And if I do, what will it tell me? And I was just interested to get your advice directly to individuals. What is the point of getting one of these tests? What does it tell you? And could it be used to make calculated risk decisions on individual behaviours?
Thanks very much, Denise. Katie, over to you.
Thank you, Denise. And this question has come up quite frequently in the past few weeks, as well as a question around the use of so-called immunity passports. And I would certainly recommend that you take a look at WHO's stance with regards to immunity passports that's on our website. Serologic tests there are many. Many have different levels of sensitivity and specificity, as you've alluded to. Currently, WHO is still in the process of reviewing many of those tests, and will issue a statement as and when we feel that a test has been sufficiently validated to provide reliable results, and that will be done through our emergency use listing procedures. As to the use of the tests so far, WHO's recommendation is that they are useful for research purposes, not on an individual level. But in order to look at the level of spread of the infection across populations, and in the European region, at the moment we have several countries, I think 9 countries, that are currently conducting serological surveys of their populations and are providing WHO with information on those surveys. And at the moment, what we can quite clearly say is that the level of prevalence in countries that are doing these types of surveys is quite low, around 2 or 3% of the population level. In areas where there's been very widespread transmission, that has gone higher. But it certainly doesn't give a sort of high population level immunity. And as for the tests, as for how they should be used, countries will be continuing to do these surveys over time to look at the overall prevalence of COVID-19 in our populations, and that will drive public health decisions. And not at the moment individual decisions. For individuals, diagnostic testing is on the basis of molecular testing, which is PCR, and that should be done when patients, as early as possible, when they are symptomatic.
Great. Thanks very much for the question, and thanks for responding to that question, Katie. We go over next to Isabel Sacco from EFE. Isabel.
Yes, hello. Do you hear me?
We do. Please.
Good morning. Thank you for taking my question. Firstly, there was a noise interference while Dr. Klunke was telling the figures that show the increase of violence in Western Europe. So if he kindly could repeat that figure, and my question, and I have one question on children again, is children are going back to school in Switzerland next Monday, and this decision was based in the fact that Swiss authorities, health authorities, say that children are not vector of the virus, of the coronavirus, and they have encouraged children to meet their grandparents. So I would like to, I hear all that has been said about children, but could someone say clearly if children are vectors of the coronavirus?
Okay, thanks. So to the first question on the RD's statement, to the regional director's statement, that will be online. Yeah. So let's move on from that. That will be online straight after this press briefing, of course. So to the second one, I will turn to Katie regarding children and virus transmission.
Thank you very much, Isabel, for the question. I think we need to learn more about the role of children. As I briefly alluded to earlier, we still have a little bit to learn in terms of the specific role of children in transmission. Based on the evidence that we have so far, it's clear that children may not play a major role in driving transmission at the community level. And the evidence seems to imply that children may have a role in transmission at the household level. So that's as much as we can say at the moment, but as and when we have further evidence to really say something more specific, WHO will surely do so. And as studies come in, on a regular basis, we are reviewing those on a day-to-day basis and adding that to the global body of knowledge that we have available to us. Thank you very much.
Thank you very much indeed. Okay, so we'll go to Interpress News now, to Salom Abulashvili, excuse my pronunciation.
Yes, it's correct. Thank you very much for the opportunity. Do you hear me?
Do, please go ahead.
Sorry, can you hear me? Okay, thank you. I would like, first of all, I have two questions, but first of all, I would like to ask, how do you assess whether the efforts taken by China and other European countries were sufficient and timely? Do you think that if some strict restrictions had been introduced earlier, we could have a completely different picture amid to an outbreak of coronavirus in the world and especially in Europe? And my second question is, Georgia received a request from the World Health Organization to participate in solidarity clinical trial for COVID-19 treatment, and Georgia expressed, of course, its readiness to participate in this trial. But my question is, on basis of what criteria was Georgia selected for the trial when it has one of the lowest transmission rate in Europe?
Okay, thanks very much. So two questions there. First on the sufficient and timely response of member states, and the second on solidarity trials. I'm going to go over to Katie to respond, please, if I could. Thank you, Katie.
Thank you for the questions. So first of all, on the timely and sufficient response, WHO and all member states took the response to this new emerging virus very seriously from the very beginning. And as our Director General and many of our colleagues have illustrated, all countries, including China, moved very quickly in the early stages of the disease and issued the sequence extremely quickly, much more quickly than had ever been expected before. which enabled other countries to take very quick measures. WHO sounded the alarm very quickly with the declaration of a public health emergency of international concern at the end of January, and a call to all countries really to grasp a window of opportunity there, and countries did. However, the virus continued to spread and surpassed the levels of spread that any of us expected, and I think here what we need to focus on is the task at hand, and we are seeing positive signs from many of the countries, especially those who are most affected in the European region first. And we're seeing very positive signs from other countries that took early measures, such as Georgia, and have seen a relatively low number of cases compared to some of the other countries in the European region. So what we have seen is countries learn very quickly one from the other. Of course, we will be looking backwards at a certain stage to see what each of us could have done better. WHO will be doing that for our own response, and we will also encourage all countries to be conducting after-action reviews when that time presents itself. But for the time being, let's focus on looking forward, continuing with the initial signs of progress that we're starting to see, and being extremely vigilant that the virus does not return and cause additional morbidity and mortality in our populations. On the second question with regards to the Solidarity trial, yes, indeed, as you say, Georgia is not the country that has had the highest number of cases in the European region or globally. However, the whole point of the Solidarity trial is that all countries can participate, and so we have invited all countries to submit interest and then to go through the approval process with WHO and guiding through a systematic and standardized approach to the trials. And that means that all of the enrolled patients in the trials the data from those will be pooled into a set of data that will really be able to use every single patient's information to inform a global assessment based on a very large number of patients. And this is really going to produce the most reliable and robust data.
Thanks very much. And on that note, I'm going to, I see it's the top of the hour, so I'm going to close this briefing. Thank you very much for joining us today. Looking forward to seeing you next week, the same time, at the same location. In the meantime, take very good care of yourselves and stay well. Thank you. Bye-bye.